Hey, good morning. The few of you that are early joiners, it's Brad and Jeff and Kasai. We're just going to give it an extra 2 minutes because we did have a decent amount of people registered, and we just want to give them a chance to find their link on their calendar. So in the meantime, if you look at the chat feature, Jeff has asked a question, and he would like you to respond to tell him what your favorite Super Bowl ad was. Since Travis Kelce didn't propose to Taylor Swift, then we have to talk about ads, which I don't remember any, believe it or not. Kasai, what was your favorite?
Listen, my home team I grew up with lost, so I wasn't very happy.
Okay, all right, I get it.
Um, I really didn't pay much attention. I don't think they were that great this year. I didn't see any.
Uh,
I don't
The
know.
one
well,
Maybe
that's
I just didn't pay attention to them.
the one that stood out for me was Arnold Schwarzenegger. I thought that was great.
oh yeah, yeah, yeah.
Yeah,
You're
He
right.
couldn't
Yeah, that
pronounce
was
the
good.
R, but
Yes, that was a memorable one.
yeah.
All
the
right, we're
most
getting several more
yeah.
people to join.
And this is my opinion, but the most unmemorable one was the Ben Affleck J Lo Dunkin' Donuts.
Yeah, I
I was
agree
No,
with
thinking
but
you.
to
I
myself,
like the Tom Brady that was
you
working
did?
the counter. That was the good part of that. He was
Oh,
the one who handed him a coffee
okay.
because Boston is the home of Dunkin' Donuts.
I know.
Yeah.
So that's why.
You lived in Boston. Yeah,
I did for
you did live
7 years.
in
Yeah. All right. Well, I think we've got 6 or 7 people joined already. So maybe we should go ahead and get started. So, hey, everybody. Good morning on this sunny morning in Ohio. Thanks for joining. Appreciate it. We're going to just do a couple of intro slides. And then we're going to have Kasai talk about uh, his Molina plans, and towards the end we'll sort of go open mic and let you ask Kasai questions. I don't know, Jeff, if we can go off of take everybody off mute and just let them verbally ask their questions. Let's just see how that goes. Um, all right. So anyway, everybody, you all know about Health Sherpa. If you're not using Health Sherpa, please talk to Jeff and I. It is the easiest platform, even for those who are technology averse. If they can shop on Amazon, they can use Health Sherpa. So simple as that. Why isn't it moving? Oh, there we go. So again, today's presentation is about Molina's 2024 ACA plans, um, and just a little bit of housekeeping. So I asked the question to put it in chat, but if you have questions of Jeff or I or Kasai, you could always type it in the box that has a question mark in it. That's where we'd like you to ask those questions if you want to get ahead of it. But then, well, you know me, you know Jeff. That's us. That's our phone numbers if you don't, and our emails to get a hold of us. So we're a great tag team, and we're relatively the same age too. So aren't we, Jeff? Okay. All right. So this is my last slide. So I'm going to kick it over to Kahassai Tafese, who's in Columbus, and he's going to talk about Molina. So take it away. Let me stop sharing, and I'm going to let you share, Kasai.
Okay, perfect.
You want me to make him the presenter?
Yeah, please. I thought you did already.
There we go.
All right.
Let's share the
Nice.
screen. There we go. Let me launch.
I'm going to
All
go
right,
off camera because I don't want to mess up the bandwidth. So,
that's fine. I can't even
yeah,
see anyone on camera right now, so anyways, because
yeah.
I'm using one screen here. Um, can everyone see my screen
Yes.
and is able to
Yep.
hear me?
You're on. Yep.
Okay, perfect. Um, Brad and Jeff, thank you so much for this opportunity, and those of you who joined, thanks again for taking the time to listen to Molina's product information for 2024. My name is Kahassai Tafese. I'm also known as KT. Everyone refers to me as KT. So if you have difficulty pronouncing Kasai, it is definitely okay to call me KT. Um, I represent Molina in Ohio, Michigan, and Kentucky. My role is slightly going to, my service area is just going to slightly change. I guess expanding. So we've had a few changes within our team structure, sales team structure. So if you sell in other states such as Illinois, Wisconsin, which used to be my states, I'll be back in those states, including South Carolina, maybe a few additional other states as we restructure our sales department. We'll give you a lot more information in the coming weeks in regards to that. At least you'll know as far as my responsibilities um, when it comes to my state of responsibilities. My contact information and my email address and my phone number is listed here for you. I'll be sure to send a copy of this. I know, Jeff, you may have this, but I'll send you an updated one so you can send it out to everyone that's in this presentation this morning with us.
Perfect.
But just a little bit about Molina. Molina Healthcare provides managed healthcare services under Medicaid and Medicare programs through a number of states. We've been around for, I believe, over 36 years now. We rank, and marketplace as well. We rank 126 on the Fortune 500 list. We currently have upwards of 5.2 million members in the four lines of business: Medicaid, Medicare, and ACA. We're headquartered in Long Beach, California. We were established in 1980, currently employed upwards of 15,000 employees in a number of states. Most of you know that open enrollment began November 1st and will end January 5th, ended in January 15th. California, they have extended, I believe some state-based, Kentucky, correct me if I'm wrong, did extend as well. So those of you who may be selling in state-based markets, you may see slight variation as far as open enrollment extension and times and dates. Molina's national footprint, we're currently in the states here. Expansion in 2024 was only limited to Illinois, in which you expanded to one additional county, bringing our total footprint to 5 counties. These 5 counties in Illinois actually constitute probably about 80% of where the population is in and around the Cook County area, Chicago market. Kentucky, we expanded to 22 additional counties, up from 3. We're looking to expand into Boone County, somewhere closer to the Cincinnati market next year. We'll see probably another 20 plus counties expansion. I think that would be great, especially for those that are the counties that are on the border between Ohio and Kentucky. South Carolina is another state where we did expand to 2 additional county, pretty much in almost the entire state except for one county. Nevada was one new state that we entered in 2024. We're in 7 counties. That's been a very tough market again. Network challenges there. But if you sell in Nevada, you may have seen some of these challenges. We're expecting to make some leads into additional network that would help hopefully improve our positioning in 2025. Going over Ohio, we're currently in 63 counties where you see highlighted in the greenish bluish here is where we are. So that's our footprint throughout the state of Ohio. Our hospital network did not change much. It pretty much stayed consistent. So, as I said, you'll have a copy of this. But just to name a few, in the Hamilton County market, our network is based primarily on the Mercy Health System, Kettering, and University of Cincinnati. So you'll see a list of that. Columbus is primarily based, in fact, our only hospital system is the Ohio State University Medical Center and the James Cancer Hospital Network. It's very narrow in Central Ohio. In fact, each carrier has really limited hospital base. For instance, Oscar's with Mount Carmel, CareSource and Molina are with Ohio State. So you'll see that each carrier has really just one hospital system. in each and really limited in Central Ohio. In the Cleveland market, we are with Metro Health System, Cuyahoga County, South Point Hospital, Southwest General Hospital, and Lake Health in Lake County. So those are our hospital system. As I always said in the past few years, I've been fighting to get university on board. It's been really tough because these hospitals are asking for a very difficult to match reimbursement rates. But I know our team is closely working with university, and I'm hoping hopefully we can have them on board in 2025. This is a continuation of the hospital systems listed here for Ohio by county. Now, one unique thing to mention when it comes to Network for Ohio, in addition to having the hospitals in the state, are members on the bordering counties between West Virginia and Kentucky. For instance, King's Daughter Hospital out of Kentucky and Ashland, Kentucky, for those who may live in Arlington, Ohio, or Lawrence County, will have access to that. Anyone will have access to the hospitals in Kentucky. That would be King's Daughter Hospital. I've listed here for you the West Virginia hospital systems that would also be available to our members. On the Kentucky-Ohio border, as soon as we bring on board additional counties that are contingent to the Hamilton County area, next year you'll see similar access to hospital systems in Ohio and in Kentucky for our members on both sides of the border. In Kentucky, we were only in 3 counties. What you see highlighted in yellow is where we expanded in this year. We're gonna double our footprint next year. It's gonna be a whole bunch of counties, so we'll be entering upwards of 20 is what we're looking at now, which will include Boone County, some of the counties closer to the Cincinnati market. Our network in Kentucky is based on U of L, University of Louisville. So as you can see, a Norton Hospital System is also in network. Value basics. So with Molina's ACA product, these are some of the essential health benefits. So our members will have access to no cost 24/7 telehealth virtual care, which is also unlimited. No cost My Health Perks Wellness Program, which we increased the incentive from only $50 last year to $200 this year. No cost preventative prescriptions, no cost preventative screenings for children and adults, and no cost pediatric vision services. I'll go into details next slide, next few slides there on our vision benefits and no cost RX savings solution. This is new one that we kicked off this year, and no cost 24/7 nurses advice line. The My Health perk, again, increased to $200 this year, and every member 18 and over would qualify. So if you have multiple family members, they could qualify $200 gift card, either digital or they'll send them a list that they can pick from. This is basically for to qualify, you will have to complete health assessment and complete an annual physical with your PCP. So definitely push this. It's a great benefits, and it could add up when we have several family members. The RX savings solution is something that we kicked off this year. This is a service that helps members maximize their prescription benefits and helps them lower their out-of-pocket costs. So members will receive or may have received already emails with details on how to access the tool, and this will include guidance into RxSS benefits and also the contact information, including the 800 number that is listed here. Definitely great saving solution for our members. Our plan design this year pretty much stayed consistent. One thing to point here, we did rename our plans. For instance, in 2023, where they were called Constant Care Silver 1, it is now just Molina Silver 1. This will have 2 options, one with vision, adult vision option, and one without. Children's vision is automatically built in for anyone under the age of 19 with all plans. So these will be considered our renewal plan. The Constant Care Silver, this is our CMS standard version. This the Molina Silver 8. That is also a renewal option. Constant Care or the Molina Silver 9, that's only available in Florida, so it doesn't really apply to us. One new plan that we are introducing, or we introduced in 2024, that is available across all of our states is the Molina Silver 12, which gives our members free primary care visits a year. That would be the new one. This is available in all FFM and Kentucky. So we kept these plans as far as the renewal Silver One pretty consistent as far as plan design with features members are familiar with, including low copay PCP for specialist urgent care, the same amount as PCP copay. We moved to integrated deductible, bringing the plan into parity with the majority of Silver plan. We also reduced the out-of-pocket max for 2024 for this plan, and routine routine adult vision is available with one of the Silver options for additional premium. The Silver 12, which does give our members for free PCP visits a year. This is a low cost option with focus on assisting members with obviously for free primary care visits. This also integrates deductible with copays before deductible on PCP, urgent care visits, and specialist and mental health services. The Silver 8 is our CMS standard mandated Silver option. Um, Again, this will be a good option for certain people who may qualify who are under this gives them a standardized plan. Again, the 9 is only available in Florida. We will continue to offer the the Gold One and Gold One with adult vision option. Interesting thing about the gold option, in fact, in some situations, we'll see that it may come up cheaper than the silver option, and it's very rich as far as benefit. So the design with minimal changes from 2023, we kept it integrated deductible with reducing the out-of-pocket max as well as the deductible. The deductible on this 1550 for family 3100. We reduced the out-of-pocket max for 2024 also to 1800 to 16 for family 16.2. We lowered the rehabilitative and habilitative services copay from $50 to $20, which is great. We have a simple coinsurance structure for inpatient services, and we'll make available the gold option with adult vision option available. Again, the 8 is a CMS standard option, which also will have make available this year. That's also renewal. Okay, I'm not going to go over the entire slide here, but just to point out a few things. So if you look at our Silver One, this is available in all FFM states. So the cost share reduction plan is what we call these. The Silver One will have a variation, Silver One 100, 150, 200, and 250. These correlate to your federal poverty level, the FPL. And then we'll have the 8, the Silver 8, which will also have its variation as far as 100, 150, and 200 and 250. Where you see highlighted in blue on the screen, I'm not sure what color is showing on your end. These are services that our members can access where we waive deductible for these services. So for instance, you can access urgent care and emergency services before deductible. Inpatient facility and professional fees may apply, but we also waive deductible across most of these plans, at least for the 100, and then the Silver 100, and across most of these where the 150 and above deductibles will apply. For primary care specialists, rehabilitative services, mental health services, substance abuse and disorder, all of these will be accessed exclusively based on copay. No deductibles will apply. So a really great benefit. Teledoc is completely free of charge, and it's unlimited, and it's available 24/7, 365. Again, great plan across the board. These are true across all of our FFM where these are available. Going into additional benefits that shows you again where we do waive deductibles for outpatient facility, for outpatient professional fee, and laboratory testing across most of these plans, in fact, is waived. And preventative drugs across the board, so no charge on those. And preferred generics across the board can be accessed with no deductible, no RX, additional RX deductibles on these. And as you can see for the Silver 1 100 and the Silver 8 100, across all benefits, there will be no deductibles on these. No deductibles will apply.
Nice.
Okay. Going for the similar information that we just covered, just showing you again additional benefits with no deductibles here and where deductibles will apply. Now we do embed our medical and RX deductibles, so once you meet your medical deductible, there is no separate RX deductible on most of these. All right. Let's see. Well, I'm going to skip over some of these. This redundant information on the Silver 12, which is the new one you will have for free PCP access. The Kentucky, again, the same thing. In Kentucky, the only difference is we only offer the Silver 1 and the Silver 12, the new option. No Silver 8, so there's no standard CMS standard options. And whereas we do also offer the Gold option in Kentucky. Okay. So most of you are familiar with Molina's provider online directory. It is obviously so much better than what we used to have a few years back. I know Jeff remembers. It's very easy to navigate. Only a couple things to point. You got to make sure that you're searching Molina's marketplace network, since we have 3 different lines of business. You want to make sure you select Molina Marketplace, because if you accidentally choose the wrong line of business, for instance, Medicaid or Medicare, you'll see that the Cleveland Clinic is a network, or every hospital and system in the state will be a network, which is not true for Marketplace. And also be sure you're searching the correct location. You can search by zip code, by specific doctor, facility, um, by search areas, by miles also. And so really very easy to navigate. If you want me to do a specific training on this, or if you want me to send you a specific network on PDF, reach out to me via email. I'll be more than happy to send you for a given area a PDF. But again, because this is constantly changing, we may have providers coming, providers leaving. So as always, I will defer to the online provider directly to be more
Kahassai,
accurate.
quick
Yes.
question. Where, because I've always had a hard time finding it, where do you change the radius? When I'm in here, I can never
Okay,
find
sure.
how to expand the radius to see more doctors. Like, where do I
You
find
see
that?
where I'm pointing right here where it says within and it shows
Yep.
10
Oh, okay.
miles.
Got it. Okay.
So just on that drop drop here,
Okay.
you just select the distance that you want. I think it goes to
Okay.
50
Okay.
miles or
Okay.
all. Yeah.
Yep.
And then
Okay.
you can also search by physicians that are accepting new patients, because we may have some providers that are in network that may not be accepting new patients. One also thing to mention, we've had issues with providers who are actually in network telling members that they're not in network. So one of 2 things are happening. One, they may be not accepting new patients. 2, they may not be aware that they are contracted with Molina as a result as being part of a hospital group, and they may not be aware. Please send me an email with the doctor's information. We'll have our provider services individual reach out to these physicians, because if they don't want to be, we have to remove them. So we've had situations where in-network physicians claiming that they're not. Those are very important that I know, that we know, so we can get it fixed. So we no longer use View, our broker portal. This is definitely a welcome technology here, Evolve NXT. Most of you may be familiar since you use it with other carriers. So definitely this is a very nice um, uh, tool, broker portal. This is fully integrated with Molina's enrollment and premium billing vendor. It gives you an intuitive experience. You are able to search for your book of business, download them into a PDF or an Excel form. You can track the status of new enrollments. You are now able to order or reorder your member ID cards for your clients directly from this site. Also, you can assist your clients to change their primary care physician. When they change their primary care physician, I'll go over the Molina member ID card. They can continue to use the same card because we don't list the PCP on their member ID card. I'll explain uh, when I go over the member ID card a little bit here.
Quick question for you.
Yeah,
Again, on that member ID card, can they get a view of the ID card? You know,
I
like a
I will. I will show you. I have one. I'll go over that.
excellent. Okay,
Yes, yes, they can, and I'll share it. I have a slide specifically that talks about it.
perfect.
All right. So, when searching for your book of business, once you log into our your broker portal here, I say do nothing. You'll see you're able to filter by effective date, pay through date, net amount due, pending termination. It gives you all type of information. I'll say just click search once you log in under your own credential. When you hit search, it's going to retrieve your entire book of business, all active and termed policies that you've had, your historic. So you can filter them to just pulling active as well if you want. But if you hit search, it's going to retrieve the entire book of business. All right. Yeah, when you order the member ID card, this is what it looks like. So basically, you can select either ordering a ID card or you're changing the primary care physician for that client. Once you complete this and you submit it, the member will receive an ID card, or they would have effectively changed their primary care physician. Um, I know many of you may have already logged in to your broker portal through Evolve. If you have not, please do so. If you have challenges, reach out to me, reach out to broker services. We can certainly help reset your password. It shouldn't be difficult. So basically, you're using your email address, whatever email address you use to get appointed with Molina, and then just say forgot password, and then you can reset by selecting a new password, and you'll have access to Evolve. If you're interested in adding and selling in other Molina states, there are 3 simple steps that you really need to follow. Basically, apply for a non-res license in the state that you're interested to sell, complete an FFM certification. I'm sure you already have done that, and log into your broker portal and add that state that you want. Really simple. And then the process is very fast. As long as you have, because we already have your background, you already have your FFM certification, UNO. So it's really getting the non-res license and then going through your broker portal and adding that state. Molina has a really nice member portal. Mobile app is excellent. It really makes life easy for the member, and it also helps you because members can do a lot more things for themselves instead of reaching out to you or member services. So this is really easy to navigate. It gives them all of their information in one secure place. It gives them access to digital member ID card, premium payments, medical records, and more. Here's what our member ID look like. Okay, so as you can see, we stop listing primary care physicians on the member ID. That does not mean we're not assigning members a PCP. So why do we do that? Because every time a member switches a PCP, we do not want to send them a new member ID card. They can continue to use the same card. On the back end, it will be reflected that they have a new PCP. And as long as they go within network, no harm done, as long as the doctor is willing to see them. So no PCP is listed for that reason. Members can switch primary care physician as often as they like, and it will be effective immediately, and they can continue to see any in-network PCP using the same card. Nothing will change. We do list some information such as deductibles, annual out-of-pocket max, co-share RX tiers 1 and 2 are also listed here and the way they're paid. Our pharmacy vendor is CVX Caremark. So our members can actually access a 90-day supply at only 2.5 times the copay, whatever the copay may be for that. So they can get a much larger supply mailed to them directly. And they could do that directly by calling our pharmacy vendor once they have a prescription or mailing in the pharmacy prescription. Okay. On the back of the card, we have some really important information, including member services number, 24/7 nurses line, billing and payments, provider number, CVS Caremarks number, prior authorization, and medical claims. All right. So our website is also another great tool of resources for our brokers. You can actually direct yourself to the broker portal directly from this. If you go select broker, and I can go over if we have time at the end of this, I can go over the website with you guys briefly. So wealth of information, including toggling between 2023 and 2024 plans, forms, documents, evidence of coverage, summary benefits, benefits at a glance, all of these, and CVS mail service order is also included. All the information needed for both members, our physicians, and our brokers will be listed on this side. Okay, binder payments method. We make payment methods, various methods available for our members. Auto pay, with Sherpa at the point of enrollment, you can actually set up auto pay and recurring payments using checking account, routing number, or credit cards. Our members have an option of paying directly on the Molina site month to month if they want. But again, as an agent, in order to avoid members lapsing, you may want to set up auto pay. They may also call our Molina customer support number and pay by phone. They may also mail a check to the address listed here to the PO box. They would have to allow 10 to 15 days for mail to process, and payment receipt is sent. MoneyGram, they can walk in any local MoneyGram locations and pay as well. So for the one-time payment, this is a hyperlink that you would be able to click on. This, it will take you to that. So members who choose to make monthly payments, they can do that as well.
Question, Kasai, that I've been
Sure.
getting a lot lately, and maybe this will actually stay it. Everybody wants credit card payment. So can it be set up auto pay for a credit card,
Correct.
or
They
it
can.
can? Okay, that's
Debit
good to
card,
know. A lot of
credit
people,
cards, they can. That is correct.
and even
The
if they
only
call
thing they
in
would
like
have to
once
be
per month.
careful is once the card expires, they'll have to remember to go back in and update their credit card.
Right,
That's the only
right,
issue
right.
that we
Yeah.
face. Yeah,
Yeah, or they can pay monthly. They can call into member services and pay
that's
monthly
correct.
as another thing too. So they can, because a lot don't let credit card payments process. So this is good actually.
That's right. That's right. So, and two new tools that we're also providing this year is people can pay with Apple Pay and Google Pay. So these are new options that we're making available this year. So what to expect following a binder payment? So enrollment and premium billing until binder payment is made. The 800 number is listed here for you. If a member makes payment before 5 p.m. Eastern time, it loads in Molina member database the following business day. It takes about 24 hours. If after 5 p.m., it is batched with the following day's enrollment. This is the 834 file that we would receive from CMS. Molina Member Services only has line of sight only once the coverage has been effectuated and the policy is loaded. Once that happens, Molina loads member's profile, removes restrictions, creates member ID card. The member ID number is what the members would use to create a My Molina account, and also prior to getting their member ID card, if they want to use that number to access care, as soon as if they don't receive it on time, they could also use that member ID card. They don't have to have their card. They could do that. Members can expect to receive their ID card and welcome kit 7 to 10 business days after binder payment is made. For SEP, after binder payment is made and SEP is validated. Bonuses this year, we do have bonuses available as we did last year. Hopefully, you guys have met, but it gives you an opportunity to actually access bonus throughout the year this year from Molina, the way we have it structured. So for new members, 25 to 49, you will receive $25 per member. 50 to 99 is $50 per member. 100 plus is $75 per member. Renewing members, renewals, any policies that you renew over 50, you'll earn $50 per member. So bonuses are paid per member per year. Members must stay active and pay through for 4 months. New member bonuses are available all year long, even with SCP, and will be paid out on a rolling basis 7 months after the effective month. Renewal bonuses will be paid out in July of 2024. Our commissions have stayed the same. So this is your street level commission by state. I don't know if you guys sell in different states, but for Ohio, it is $16 PMPM. This is your street level commission. Kentucky, what was Kentucky? Kentucky is 80 PMPM. So there are variation. You know, some states pay more and some states pay less. So if
Florida.
you have business in these other states, this is our
Florida's
commission
pretty high.
structure, street level. Okay, contact information for our broker services. So our broker services hours are Monday through Friday from 6 a.m. to 6 p.m. That is Mountain Standard Time. New broker portal account. So this is Evolve. There's a link. These are all hyperlinked that will take you directly to these sites. For broker services is option one. They will help you with general inquiries such as access to care. I'm sorry, account access issues, member evidence of coverage, so many benefits type of questions. The broker care team is option two. Member access to care issues, billing discrepancies, termination and error. Our commission team will help you with book of business reconciliation and missing or unpaid policies. Please feel free to reach out to Cornerstone or reach out to me as well if you have any questions in regards to that. We'll help you research those. And contracting team is option four. So contact them for appointment related questions, E&O, license, and if you need to update your contact information. Molina has unique member services number by state. So for Ohio, it's the 888-296-7677. Before I forget, I know Brad asked me to go over how we cover our vision coverage. So our vision is provided through VSP as our vendor. Our members will have free annual exam, $150 in allowance towards glasses, frame, and contact lenses as an option. If they buy something more than that, they would just have to pay the difference. So VSP is really straightforward, simple. Any child under the age of 19 will have vision coverage built in with all plans at no additional cost. Molina does not have any dental coverage, either separate or embedded. Okay. Our team is slightly changing. Our director, Eastern Region, in fact, Fabian is now a national director. He's over the entire state. Although for anyone Spanish speaking, if they need specific materials or presentations, Aldo is your man. Tina Martinez has moved on she's been promoted, so she's no longer the MSM for Florida. We'll give you more information about her. She is the director of operations now for our marketplace product. Lindsay and I will continue to cover both. Kristen is also going to be in different role. So she was over Illinois and Wisconsin. That's why you will see some shift as far as territories and responsibilities for each of our broker channel managers or sales managers. Okay. Here are the rest of the sales manager. Again, I'll send you this list, but some of the roles have changed. So for Kristen and Tina, any of their agencies, you'll need to reach out to me for their states. And then for Rhonda is now the director of broker services. So she's actually running our broker services department in Utah. That brings me to the conclusion of this presentation. Thank you so much again for your time. I'll be more than happy to answer questions that you may have. Thanks.
So, Kahassai, one good one on the RxSS program. Could you go into a little bit more detail about what what it what are the savings members see on what items? Is it generic? Is it brand? Is it an additional discount? Can you just tell us a little bit more about that?
Yeah, so once member, you've seen those prescription discount cards that pharmaceuticals offer, right?
Yeah.
It's a similar program in which it gives them access to various discounts available for the prescription that they may be picking up. So this is why they will need to create an account, log in, and see various and look up the medication that they may be taking, and it will give them a list of prescription that discounts may be available in addition to obviously whatever Molina pays.
Right. That's nice because
Yeah.
especially, I mean, it
So
goes, it really
it's a
applies more to a
one-stop
brand.
location that you can log in and say, okay, I can get additional discount for this prescription. So it
Right.
gives you access. All Molina
It's a
members will
resource.
have access to a
Good.
digital available discounted medications.
Great. Let me see if anybody typed in any questions or Jeff, I don't know how to do this to unmute everybody, but maybe it's easier to unmute
Yes, if it's a
everybody.
small group, let's do it.
Yeah. Let me see if I know how to do that. All right, everybody. I'm going to try to unmute you all. Um, I tell you what, there is a reaction button in the lower left-hand corner. It's a hand. If you have a
Hmm.
question, click that on, and then I will unmute you to ask your question. And just FYI, for those of you in Northern Ohio, I hope that you received your invitation to the individual expo that Cornerstone is having around the Cleveland Hopkins Airport. So if you haven't gotten it or you're still considering whether you should come, it's going to be really great. We're going to have about 8 to 10 vendors there. I think 7 of which are carriers. Other than doing the presentations, nobody's really gotten to meet our carrier reps face to face. So this is one of the big things that I wanted to do, and we're piloting the program for the rest of the state because we may offer it in Southwest Ohio, Northwest Ohio, Columbus, Central Ohio. So I hope you can join. I think it will be a really nice opportunity. Um, to just there's never been anything done like this in Ohio for the ACA individual market, and not just ACA. It's also short term and all of that, and dental and vision. So it's a really great program. If you haven't seen it yet, let us know. You can actually in the Monday Minute that was sent out yesterday. It actually has an advertisement for it. So you should be good to go on that. So I don't see any questions coming in.
I did have
So,
a question for
okay.
Kahassai. Um,
Yes.
in terms of the ID card, I notice it doesn't really generate from the broker view. I don't think it generates an actual picture of the card. It enables you to send a request for a card. Is that right?
Yeah, it's not where you can retrieve and print. Initially, that's what we were hoping. That's what actually we were told. But you are able to order a card.
And how quickly?
And also you are able to give them the client their member ID number. They can actually use that number
Yeah.
to access care. They don't
Okay.
have to have a physical card. Second,
Hmm.
uh, you obviously want to advise your clients that they can create a My Molina account and access a digital card on their
Understood.
cell phone. Yeah.
Okay.
So, but
You know
unfortunately,
how it
you're not
is.
going to be
It's
able to print and just hand them out or
yeah.
save a PDF copy of it.
Yeah. Okay. Fantastic.
Yeah.
That's great.
Fantastic.
Kasai, on the vision benefit, you said the frame allowance. What kind of lenses are included with that? I know it's probably single vision bifocal, but are standard progressives included or no?
Yes. So when you go to a network provider, they're going to show
Yeah.
you. They're going to give you a list of a Molina covered options that
Okay.
they have. So
Okay.
depending on where you go, some may have better options than others. So I would shop around. And then again, if you choose to get something, we're gonna pay the $150. And
Yeah.
if it's beyond that, the member will have to pay the difference.
Right. Yeah, because it comes to lenses. Like a lot of the offers you hear are only for single vision lenses, but a lot of people would use bifocals, lineless bifocals, or standard progressives. And
They
I
can
think
use
there's
any of
4 different
that.
levels of progressives. So
Yeah, we don't
yeah.
limit it to, we don't
Okay.
limit it, and they can
Okay.
actually get contact lenses as well. So as
Yep.
long as
Obviously. Good. That's all I had. I'm not seeing any questions from anybody. So
and
I
just
think
a
we can
couple
let
of things
everybody
that I
go.
wanted
Oh,
to
oh,
also
yeah,
point out,
sure.
Brad, is up and especially in Cleveland area with I think Metro, not Metro, with Lake Health. was recently, I think last year, was purchased by university. There was some nervous
Yes.
agents that were calling me whether or not Lake Health will continue to be part of Molina's network. I just want to make sure that everyone knows they are in network, will continue to be in network, even though they have been. Similar thing happened here in Central Ohio, where Berger Hospital in Pickaway was purchased by Ohio Health, which is not an in network. We continue to carry Berger Hospital as a network. So just wanted to make sure if no one did not know that they know now.
Yeah, well, maybe if you when you pay the claims that those hospitals submit and they see you do a good job at it, they'll let you have the rest of university hospitals. How about
I
that?
hope so.
Yeah, right. Good, good. Jeff, what else?
Oh, that's great.
That was
I've got
it?
nothing to add.
Me either. All right,
Actually,
everyone. Thank you so much for joining.
All right.
Again, this whole presentation, Kasai's going to send it to us right now. Our marketing person will stick it in an email that you'll receive later this afternoon. I think she's there today. If not, it'll be tomorrow. And then this will also be downloadable on the Cornerstone website. So you can do that, crnstone.com. And then you'll be able to view the whole presentation, look at the slides, but Kasai is going to send them. So you'll be able to print up what you want, much easier to read. And you don't have to listen to me again. So anyway, all right, everybody, have a great rest of your sunny day here in Ohio. So enjoy it, and we'll talk to you next time. Bye
All right.
now.
Thanks,
Thanks.
guys.
All right,
All
Kasai,
right.
thank you.
Thank
Bye.
you. Thank you, everyone.